Hello, my name is Kayla, and this is my baby assessment. So I'm first going to check my charting, or check my history for my patient. Look through maybe the mom's chart as well. See how she delivered, if there were any complications, if there's anything that I need to know that's important to my assessment. Also going to check medication, make sure there's nothing due at this time. And see if the previous medication was given correctly as well. So I've done all of that. I've gathered my equipment. I'm going to perform hand hygiene and enter the room. Knock, knock. I'll enter the room. I'll make sure I close the door, providing privacy. Again, completing hand hygiene so the patient sees. I'm going to introduce myself. Hi, I'm Kayla. I'm going to be your nurse today. Can you confirm this little guy's name and date of birth for me? They confirm name and date of birth, and I check that with the ID band. I'm going to first talk to the parents a little bit, ask them some questions, how he's been sleeping, eating, voiding, if he's been excessively crying or excessively sleeping, how they feel. This is their first baby. So I want to make sure they're doing okay as well. If they need anything, of course, I'll ask that at the end of the assessment. So this baby is currently sleeping and wrapped up. So I'm going to go ahead and unwrap him. I'm going to do my auscultation first while he's calm. I'm going to listen to the heart. I'm going to listen for a full minute to detect apical pulse. This baby's apical pulse is around 130, which we will find is normal. Listen here. I'm also listening for any adventitious sounds, no murmurs or anything like that. I'm going to go ahead and listen to the lungs. Make sure I hear equal, non-labored breathing bilaterally, which I do. I also hear that the respirations are about 42, which is also normal for this baby. So he's beginning to wake up, so I can go ahead and I'll assess abdominal sounds really quickly, which I do hear in all four quadrants. And then I'm going to start this baby's vitals. I'm going to take blood pressure per hospital protocol. Some have them do in all four quadrants. I'm just going to do the left arm at this time. Baby's blood pressure is 80/40, which is normal. Then I'm going to take temperature as well, which is 98.7, which is normal. So I see that all of his vital signs are normal at this time. I'm going to go ahead and take head circumference measurements. I'm going to measure his length and take those measurements and document my findings. I'm also going to weigh the baby, see if he's been gaining weight or losing too much weight. This baby came out 7 pounds 1 ounce. He's now 6 pounds 8 ounces. So we know that anything between 6 and 10% weight loss after delivery is normal. This baby's 48 hours old, so I'm going to ask the mom and dad how bowel movements are and if he's been voiding, and this baby has. This baby's been sleeping normally, waking up agitated when he's hungry, which is good. He's been latching okay. So I'm going to continue with my assessment. I'm going to start just doing my complete EENT assessment. This baby does not need any glucose monitoring. So I start with the head. I already took the circumference measurement. I'm going to make sure that I don't see any. I'm also going to check the fontanelle, make sure it's not sunken in or swollen. Don't see any of that. I'm going to check this baby's ears, make sure they're symmetrical and that I don't see any excessive draining from any orifice. I'm going to check this baby's eyes. I don't see any excessive draining. A few tears in the tear ducts, which is normal at this time. I'm going to open the baby's eyes. I'm going to flash a little light in there, which he's not going to like, and I'm going to see that the eyes are symmetrical and they do react to light. I'm going to check the baby's nose. Again, no excessive drainage. It is symmetrical. And check the mouth. See that it's moist. Gums are intact and pink. I'm going to do a full assessment of this baby's skin. Make sure it's not too dry or too moist. Make sure it's nice and warm, not too warm. And I'm going to check the capillary refill on this baby. It's less than 1 second or less than 2 seconds. And I'm going to make sure I don't see any abnormal bruising, which I don't see on this little baby. I'm going to, of course, go down and palpate the belly, make sure I don't feel any abnormal masses, or he doesn't get extremely upset when I feel that. Try to assess if he's feeling any pain at this time, which it doesn't look like he is. Now I'm going to go down and assess his perineal area. I'm going to take his diaper off, which I see is wet and soiled, so I will change that for him. It also tells me that he's having regular bowel movements and voiding. I'm going to measure that before I throw it away so that I can document that as well. I'm going to assess this baby's incision. As I said, he's about 48 hours old, so he did have a circumcision, and he did have a circumcision. So I look at that, make sure I don't see any abnormal ecchymosis, swelling, abnormal drainage color, so I don't see any of that. I'm going to make sure it's nice and clean and reapply the Vaseline before I put the diaper back on. This time I'm going to roll him over. I may assess the lung sounds, again checking for bruising, abnormal swelling. I'm going to check the sphincter reflex and make sure I don't see any abnormal redness, bruising, dryness, or anything of the sort. I'm going to put this baby's diaper back on, and I'm going to go down, look through the legs really quickly, make sure, again, no excessive bruising, dryness, anything abnormal with the skin. I may do a Babinski reflex, looking for a negative reflex. I do see this baby is being active. He is responding to my touch and my voice. He is, right when I took the blanket off, he flexed, which is good. So I'm going to start to wrap this baby back up just so he's not cold. And I'm going to check his clavicle line, make sure I don't feel any breaks, which is possible during a late vaginal delivery if he had to be pulled out in a different way using any tools. So I also look at his umbilicus. I see that it's drying up nicely. There's no bleeding, swelling, or drainage around that area either. I'm going to wrap him back up. He is awake now, so I'm probably going to hand him off to Mom if she's awake, which she is. So I've handed him to Mom. He stopped crying now because he's about to eat. And I'm going to lastly ask the parents if they have any questions and concerns. At this time, they do not. We already talked about him going away for his incision yesterday when I was on shift with this family. And other than that, I'm going to let them get some more rest. There are no medications due at this time, so I'm going to let them spend some quality time together. I'm going to make sure they have the call light, make sure they're in a comfortable position, both mom and baby, make sure that the cradle is next to the bed. And I'm going to document my findings and hand hygiene as I exit the room. And after I exit the room, I'm going to make sure everything is clean. I wipe everything down and call the doctor if I find anything abnormal, which I did not.